So time to next treatment is a concept which is increasingly emerging for patients with AL amyloidosis, because the decision to change treatment from first line to second line or to a subsequent line is actually a multi-parametric decision, which does not only have to do with clear-cut hematological progression, but increasingly we're also assessing organ progression for our patients, so whether there's a deterioration in organ function, and as well as the concept of when you have achieved a suboptimal response, even though it might not be disease progression, you have to consider strongly to change treatment for these patients, because there's increasingly more and more data showing that you have to achieve very early on a very deep hematological response in order to increase survival and outcome for these patients. And this holds mostly for the more advanced stage patients, like stage 3B and stage 4 for cardiac involvement. So this means that using the time to next treatment as a surrogate marker, so patients who will change treatment before or after 6 months could probably reflect this multi-parametric decision-making in the management of these patients. And this is what we try to look at. And actually, time to next treatment is associated with a higher Mayo stage and impaired renal function, and it is associated with a worse outcome if patients will progress before or after 6 months. So we can potentially start to use these landmarks and these time points as surrogate endpoints in the management of our patients.